Next up, we have Rx Health and Rick Strobridge, who is the CEO. Go ahead, Rick.
Yeah, thanks a lot, David. Hello, everyone, and thanks for inviting me to this showcase. We're very excited about our partnership with Microsoft. It's been very good over a number of years. Rx Health is a digital health unification, automation, and monitoring platform. Our customers include both healthcare systems, life science and pharmaceutical companies, and payers. And the whole idea behind what we're trying to do is really automate and unify digital health assets into one electronic health record connected service. We started out of Mount Sinai Health in New York. We were actually the very first digital health formulary. We operate within electronic health record systems such as Epic in the Epic App Orchard, Cerner, Athena, Allscripts, and also some specialty EHR. And we're operating today in about 40 healthcare systems and facilities. Next slide. So when the Chief Innovation Officer of Mount Sinai Health faced a growing digital health ecosystem, the problem he set out to solve through what has now become Rx Health was, how do I unify this fragmented digital health ecosystem and provide the benefits and ROI of digital health at scale? How can I create digital transformation within my facility, apply clinical intelligence, and do that all in a way where it's a self-service SaaS platform which can meet the needs of a particular workflow within a particular facility, not a standardized or templated workflow. So when Rx Health was spun out from Mount Sinai as an independent company a few years ago, we had a scientific background, we had a clinical background, we were embedded in the electronic health record system, and we set out to engage patients and other stakeholders using what has now become 250 plus automated care pathways. Typically, we'll enter a facility or a system and we'll start with a particular pain point. Yale New Haven Health is an excellent example of that and a good customer of ours. They needed help during COVID with really ramping up their telehealth consults from only a few dozen per day to what is now over 5,000 per day. And this is certainly a predictor of what's going to happen in the future. We've seen the pendulum swing from these in-facility visits all the way over to really trying to understand what's happening to patients on a minute-by-minute, day-by-day basis to create that conversation, to create that understanding, that engagement, but in an automated way that is actually efficient and scalable. So these 250 care pathways using a variety of different Azure components include different pieces and tools such as AI patient matching and really looking at the data within the electronic health record and then surfacing digital assets that might be good for that particular patient. We can also prescribe in bulk. During COVID, we were part of an NYC Stop COVID initiative where we reached out to over 1 million New Yorkers in 2 weeks using our platform and the scalability of Azure. We use connected devices and wearables to collect biometric information from patients. We talked about the rich depth of data and clinical intelligence information that we get from our connectivity and our deep integration with electronic health records. We have genomic data system access. We provide patients and their care teams and caregivers with education via these automated care pathways. We have appless two-way telehealth via their mobile devices. And we can have both validated and custom electronic patient-reported outcome surveys, e-consents, and that kind of thing. It all happens within a mobile environment that starts with a text message. Within that text message, a link is clicked, and that can create a care pathway that can go minutes, days, months, or even years long in the case of chronic disease. But it takes patients through that particular episode of care in a way that makes it easy to understand and again engages in a conversation and collects data which then lands on customized dashboards which fit the clinician's workflows. So as I said, we were built by clinicians. We started within a health system. We understand the uniqueness of each health system and their particular workflows. We've been awarded the most evidence-based digital health platform, and we have an offer on the Azure Marketplace for a free trial of the platform let us show you the ROI. Call us for a demo if you like. We're happy to show how we can help both healthcare payers. We're doing a lot of work around social determinants of health and real-world evidence collection for life science companies. Thank you.